Hi everyone, it's Lisa with livingwithasthma.net, and we're excited to share with you another of our Asthma House Calls series, where we get to sit down and talk to some of the very best doctors who are treating asthma in children. Today we're here with Dr. Francisca Yao. Dr. Yao is with ENT and Allergy Associates in New York. She's board certified in otolaryngology and head and neck surgery. Thanks for being with us, Dr. Yao.
Thanks for having me.
Now, just to get started, I know there's a lot of misconceptions out there about asthma. What is asthma, and why does it seem like so many children have it?
Lisa, asthma is something that is a word, I guess, that everybody is very familiar with, but there's still kind of a lot of ambiguity to it. And the way that I like to kind of think of it is it's a chronic disorder that involves inflammation of the lungs, and that can make breathing more difficult for the people that have it. It also involves very common symptoms, things like cough or wheezing, sometimes even chest tightness. And many children, even if they haven't been formally diagnosed with asthma or a lung problem, can manifest those symptoms. So it's very easy, and it's a very common type of thing to see, those constellation of symptoms that might suggest asthma in many children.
Now, I know a lot of children with asthma, they've generally been seeing their pediatrician, perhaps they've seen an allergist or even a pulmonologist or pediatric pulmonologist. For those parents who haven't taken their child to an otolaryngologist, or usually what I call an ENT, for
Yeah.
their asthma, can you tell us a little bit about what an ENT does and how you fit into the asthma treatment program?
Sure. One of the most important things with asthma and any kind of chronic disorder is really a more comprehensive type of care. And what I mean by that is kind of a teamwork approach. And so while ear, nose, and throat doctors or otolaryngologists may not be the first person that one thinks of, the way to think of us is we're the doctors that take care of the upper airway. And asthma involves the lower airway. So the upper airway is kind of like the front door to the lower airway. And many of the symptoms that we oftentimes see and treat can be a sign of underlying asthma. So oftentimes we're actually seeing kids that haven't yet formally been diagnosed, but there's a question of. Or sometimes we'll see children whose asthma has become a little bit more difficult to fully treat or to control. And the pediatrician or pulmonologist might have a question as to whether or not there's an ear, nose, and throat problem connected as a reason why things are becoming more difficult to control. So really, I think of it as the area that we take care of is kind of the area that's connected. So the nose is the part of the lungs that we can touch, and oftentimes those things are connected with symptoms as well.